Good afternoon, everybody. Thank you for joining us again this afternoon, the second of our three state action planning webinars on PFAS policy. Really excited to welcome many of you back and really excited to welcome the Ohio team this afternoon to talk about some of the innovative work that they're doing on testing in private well water. Just as a reminder, if this is or if it's your first time joining, Chris Fletcher. I'm a project manager in the energy and environment work at the National Governors Association. We are the membership organization of the nation's 55 governors of states and territories. We've partnered with our friends at AAAS and Resolve to really go out to some of the states uh, to look at the innovative policy that many of you are doing and to really elevate that so that other states can see what each other are up to and uh, be able to learn from each other. So I wanted to provide a quick moment of welcome for you all and really excited to have this and turn this over to our friends at Resolve to kick us off.
Great. Thanks so much, Chris. And hi, everyone. I'm Maya Brightberg-Smith with Resolve, and I'll be facilitating the webinar today. As Chris mentioned, this is the second of three webinars. We had one on March 19th featuring Colorado's Action Planning Policy Summit. And we have one coming up on April 30th focused on Maryland's Policy Planning Summit related to biosolids and kind of wastewater effluent used for spray irrigation. Today, we're here to share the results of a policy planning summit with the state of Ohio and focused on their voluntary testing and mitigation program to address PFAS in private drinking wells, which we know is an issue in many states across the country. You may have received this link by email earlier today, but I'm just dropping into the chat a link to the AAAS EPI Center's website where you can find information about all three state policy planning summits. And so just on the next slide, I think you should be able to see an agenda for today's webinar. But these policy planning summits were an opportunity to bring together scientists, peers, representatives from across state governments to support deep thinking, dialogue, and collaborative planning policy development. And Rebecca Eicher from the AAAS EPI Center will share more about the policy planning summit approach and as well as some of the key science presented at the event in her presentation that's coming up next. After we hear from Rebecca, Jean Phillips from the Ohio Department of Health will present on the context in Ohio, some key takeaways from the retreat or the policy planning summit, and the kind of resulting plan, kind of what resulted from the event and where they're headed next. After we hear from Jean, we will have time for questions and discussion and encourage all of you who are here today to raise your hand, ask questions, or you also have the opportunity to put questions into the chat. You might notice that this Zoom that we're in right now is a meeting and not a webinar. So you can raise your hand, you can use the chat, but just encourage you to stay on mute when you're not speaking because just to minimize distractions. We are recording the webinar, and so just always good to flag that for you, for people, so you know that this is being recorded and it will be shared publicly after the event, so that more people can learn from what's being shared. And then at the end of the webinar in the wrap-up phase, we will invite your feedback via a survey. So keep your eyes open for a link into the chat for an evaluation survey. And you may have also seen that the event is being transcribed when you joined, and that's just so that we have notes for internal use. I think that's everything from me. And so I want to turn it over to Rebecca Eicher, who's a project director at the American Association for the Advancement of Science Center for Evidence and Public Issues, to talk more about the State Policy Planning Summit approach and some of the key information that was useful in this Ohio event. Rebecca?
Great. Thanks, Maya. Welcome to all of you, and thank you for joining us for this second of our PFAS State Policy Planning Summit discussions. We're thrilled to have you all here, including our partners from the National Governors Association and our speakers from Ohio. As Maya mentioned, we will ask you at the end to fill out a survey. It shouldn't take long, just 2 to 4 minutes, and it's just really helpful for us to learn as to how we're meeting your needs and what else you might be interested in learning about from us. So as Maya mentioned, I'm going to take a couple minutes to share with you a bit about the EPI Center, context for these policy planning summits, as well as some of the scientific information and expertise that was shared during the Ohio meeting. Next slide. So the EPICenter's mission is to build trusted relationships between scientists and policymakers at all levels of government to make it easier for decision makers to access and use scientific information and for scientists to engage with policymakers at scale. We work to bring clear, concise, and actionable scientific evidence to decision makers to help them in their process. We are a nonpartisan, non-governmental organization, and we have valued our ongoing partnership with the National Governors Association related to this work as well as other topics. So we see science being key to addressing many policy issues, and we work on a range of topics, including PFAS. During our virtual event today, we will be talking about PFAS, per and polyfluoroalkyl substances, which you all probably know are a class of thousands of synthetic chemicals used to make products resistant to water, heat, and stains. PFAS, often referred to as forever chemicals, do not easily break down in the environment. They are difficult to destroy, and they have been linked to numerous human health issues. Many of you, I'm sure, are aware that the US EPA finalized national primary drinking water standards for 6 PFAS in April of 2024, and many states continue to work to address additional PFAS issues, which is why we're here today to talk about PFAS in private drinking water wells. Next slide. We started working on PFAS back in 2019 when the AAAS EPI Center was just launching. And over the years, we've had a lot of different ways in which we try to help decision makers understand the scientific evidence around PFAS. We've developed materials, including fact sheets and guides for local and state decision makers. In addition, we have been hosting virtual events that allow scientists and decision makers to share knowledge, ask questions, and explore PFAS policy options. And then most recently, we have started to directly support states in developing statewide PFAS policies and programs, which they have identified and where we think we can help provide some of the scientific information needed. Much of our information is available on the AAAS EpiCenter webpage. So recordings of our events, our virtual events, as well as many of the materials that we've developed are available on the website. So a little bit more about our statewide policy planning summits is on the next slide. So in partnership with NGA, we put out a request for proposals in early 2024. And those were requests for proposals from states and territories interested in addressing PFAS issues that they were dealing with. We received numerous applications, and it really wasn't an easy decision as to who we would be able to provide this opportunity to. We ended up selecting Ohio for several reasons. First, Ohio was updating their PFAS statewide action plan, and in that process recognized the need to develop a statewide program for private water systems and sampling and mitigating PFAS. PFAS in private water wells or private water systems is an issue throughout the US, and millions of people get their drinking water from these private drinking wells. So this is clearly an issue for many states and is an exciting opportunity for us to share what we did and learned with the folks in Ohio. Ohio's application clearly laid out their interest in developing a statewide method for sampling, identifying a prioritization plan for sampling and mitigation, and then developing a plan to actually mitigate any wells that tested above those MCLs or maximum contaminant levels for PFAS. So we were excited to see that they had really thought about and identified what they needed additional scientific information on, as well as seeing that this could really help to serve as a model for other states interested in addressing PFAS in private wells. Next slide. So once we selected Ohio, we worked with the team in Ohio, as well as NGA and Resolve, to design an interactive convening of interagency groups from Ohio and PFAS experts that included folks from within the state of Ohio and from outside Ohio. So one thing that we were able to do was bring in some states that have private well sampling programs already in existence, and that was folks from New Jersey, North Carolina, and Michigan. But in addition to hearing from those states and providing a bit of peer-to-peer learning for the states involved in the conversation, we were also able to bring in some experts from the U.S. Geological Survey. So those experts were Kelly Smalling and Paul Bradley, and they discussed work that they've been doing to sample tap water throughout the U.S. So the next couple minutes, I'm going to talk about research that the USGS has been doing. This is not my research. I'm not the expert on this research, but I'm going to summarize what we learned from Kelly and Paul, and then highly recommend you take a look at their paper, which you can access through that QR code in the bottom of your slide. So as I mentioned, this is a study to look at PFAS in tap water throughout the United States. And what they really did was collect 716 total tap water samples from all 50 states. This included samples from unregulated private drinking water supplies, as well as the other set of samples were for public water supplies. For the private drinking water sampling, they used a citizen science approach by using mail-in PFAS test kits. This was a way for people to sample their own home's tap water and then send the kits back to the folks at USGS for analysis. This provided a more cost-effective way to sample throughout the entire US without having to send a USGS scientist into each home to sample the tap water. So this figure shows you some of the results from this, and the bulleted list on the side of it gives some summary results from their study. So at least one PFAS was observed in 30% of the tap water samples collected. And the concentration ranged from less than 1 to greater than 300 nanograms per liter, depending on the location. So you can see there's a fair amount of variety in what was coming in, but also that they are seeing lots of PFAS in private wells, as well as in public supply tap water throughout the US. They found that there were multiple drivers of PFAS contamination, which includes the distance to the nearest potential source, the number of potential sources, the type of sources. And when we talk about type of sources, you can think about industrial sources, so manufacturers of fluorochemicals or users of fluorochemicals, as well as airports, the Department of Defense, wastewater treatment plants, oil and gas activity. Those are all the different kinds of sources that they're talking about. And then also an additional driver can be the surrounding land use for an area. So this USGS study and the longer term tap water sampling project that the USGS maintains are excellent references for nationwide PFAS sampling. The USGS scientists develop methods for these mail-in test kits that they can discuss in more detail with anyone who's interested. If you would like to reach out to Kelly, Paul, and Kristen, those are the lead authors on this project, please let me know. They're happy to share have me share their email addresses with you and talk with you about the questions that you might have or help you think about what the studies are telling them for your state. Next slide. So in addition to the USGS scientists, we were also able to bring in PFAS expert Dr. Detlef Knappe, who is the S. James Ellen Distinguished Professor of Civil Construction and Environmental Engineering at the North Carolina State University, where he's also the Deputy Director of NC State's Superfund Center entitled Environmental and Health Effects of PFAS. So Dr. Knappe has been researching PFAS for decades, has many published papers. I just took a screenshot of a smattering of these different papers, but really has wide expertise and has been leading a research lab that also publishes on these many different issues around sources of PFAS, exposure, treatment and mitigation options. So he really has a team of experts that can talk about a lot of the different challenges related to sampling, treatment, and mitigation of PFAS in drinking water. So on this slide, I'm sharing some of what Dr. Knappe shared with the Ohio team around considerations for prioritization of sampling in private wells. So first, being able to map the PFAS sources allows you to see where these sources are on the landscape, and then can help in identification of the number of likely PFAS sources around private water systems. Likely sources, again, include things like fire stations, firefighting training installations, airports, military bases, landfills, fields that have received biosolids, and those industrial sites that are fluorochemical producers or fluorochemical users. So again, you can see those sources are similar to some of those identified in the USGS paper that I mentioned just a couple minutes ago. So using this information on likely sources can then help identify the private water systems or private wells that are in close proximity to these sources and help select which wells you might actually be able to sample. In addition to prioritizing which wells to sample, the next question you might ask yourself is, well, what are we going to test for in those wells? Because although this retreat focused on PFAS, what we also talked about was the opportunity to sample for additional chemicals of concern or other concerns that might be in a private well. Again, these are unregulated, so this is a homeowner or private well owner's chance to really know what might be in their well. So you could consider testing for PFAS, which PFAS needs to be thought about, as well as things such as total fecal coliform, arsenic, nitrate, lead, copper, iron, manganese, or even volatile organic compounds, also known as VOCs, to really help people understand the different things that could be contaminating their private water systems. Again, because these are privately owned, scientists have found that developing recruitment materials and outreach strategies can help explain why people would want to test their wells. So you can't require it, but you can certainly help them understand why this sampling could inform their understanding of what is in their drinking water. And then Once you've got folks ready to sample or have done the sampling, what are you going to do with the results, and how can you help them understand and interpret those results? So you'll kind of have to have a plan about reporting results, what the results mean, and what mitigation options private well owners have. So I have one slide on mitigation options. I'm that person, Maya, I'm sorry. So we talked a fair amount about mitigation options, and this is just to kind of put out there what some of those options could be for private well owners and states as they're thinking about options. So you have point of use filters, whole house filters, drilling a deeper well, and connecting to public water. And the sub-bullets under there are sort of points of consideration around each of these mitigation options. So I've gone long, but it's hard to tell the story of someone else's science. So I hope that this was informative, and happy to answer any questions that you might have, as well as put you in contact with Dr. Knappe and the folks at USGS.
Great. Thanks so much, Rebecca. And I see someone in the chat is asking for some of that contact information. So it sounds like folks are quite interested. So next I want to invite Gene Phillips to turn on his camera and present. And Gene is the Chief of the Bureau of Environmental Health and Radiation Protection in the Office of the Medical Director at the Ohio Department of Health. And Gene, turn it to you for your remarks. Thanks.
Thank you, and good afternoon, everyone. As Maya indicated, my name is Gene Phillips. At the time of all this work, and until just recently, about a month ago, I was in the role as Chief of the Bureau of Environmental Health and Radiation Protection at ODH in the Medical Director's Office, but have since work in the Medical Director's Office now, and I'm the Chief of Health and Safety Operations. And so we are working to fill the Bureau Chief position in Environmental Health and Radiation Protection currently, but just wanted to provide that clarification. So at the time, that was the role I was in. But we're wanting to talk mainly today about our PFAS testing efforts and planning efforts over the past year or so and moving forward into the future. And so if we could go to the next slide, I'd appreciate it. In order to talk about that, I wanted to provide some background information, if you will, on our program and some of the things that we've been doing to date. And so just to provide some context, ODH obtained regulatory authority over private water systems in 1981, which sort of regulated well permitting and some basic sampling for total coliform upon well construction completion, along with the requirement for well logs to be filed with the Department of Natural Resources, kind of a joint program there. In 1984, contractor registration was added, and we now register, ODH registers, the Department of Health registers private water systems contractors if they're producing or developing a well or any other private water system, which can include ponds, cisterns, springs, under certain development criteria. So those are all part of the regulatory authority. And Ohio EPA, who our counterparts, our partners are on this call too, should there be any questions, regulates public water systems. And there's a definition for both, what constitutes a public water system and what constitutes a private water system. But largely it's just small numbers feeding, serving a small number of people for the bulk of the time. But as we contemplated this effort, we know that Ohio has approximately 900,000 private water systems or private wells used by about 2 million residents. And we also know that about 500,000 of those wells are 50 years or older. So many of them predate our regulatory standards, development standards for permitting and even well construction. So On this slide too, we wanted to point out that there are, this is just if you could go back, please. We referenced the Department of Natural Resources. The map that you see there is an indication of just one area of the state, one county. Actually, it's a section of a county where private water systems are indicated as the blue dots. And this is part of the map. This is part of the filing of well logs with Department of Natural Resources. Those all get logged into a solution, and we can pull that data and map it. And then you can see agricultural wells are indicated in green, and the purplish pink color is municipal wells. Next slide. So in 2019, Governor DeWine charged the Department of Health and the Ohio Environmental Protection Agency to create and release a PFAS response strategy or an action plan. And so that plan was released I believe it was around September in the fall of 2019. That plan set action levels for the constituents you can see there in sort of the light blue square of the fact sheet. So PFAS and PFOA, those had standards already set, but then also for Gen X, PFNA, PFBA, and PFHXS. Part of that strategy was established such that Ohio EPA was going to sample public water systems. This was a joint response plan or action plan where we worked jointly together to release information about the plan. We developed a website. There was marketing, a little bit of marketing around it. Lots of fact sheets and guidance documents were created to support the work. But the plan was that Ohio EPA was going to go out and sample all the public water systems, and as they received detections or exceedances of those thresholds at the time, then we would go in, the ODH, along with local health department partners, would go in and work to get wells sampled in that area, as indicated either by proximity to a known source or a suspected source. Maybe it's based on the direction of groundwater flow or their location in proximity to sources, et cetera. So, and how the water was flowing. And so it was all this analysis that was done that would indicate where we would sample. But it was, again, following Ohio EPA's sampling of public water systems. In that first round, which, I mentioned this was basically the fall of 2019. So we all know what occurred in 2020. And so really sampling efforts, and our Ohio EPA friends are on, and they can correct me if I get some of these dates, if I'm off on some of these dates, but approximately the middle of 2020 is when sampling began. And so, of course, there was an exceedance that was identified, and that first round of sampling, where we sampled 126 wells, occurred late in 2020 and into the first part of 2021. And, as a result of that, we had, like we said, we created lots of fact sheets and guidance documents for homeowners to talk about generally what PFAS are, how to reduce exposures. We have information on treatment of private water systems, different treatment options. We also talked about health effects. And we talked about and had a video just to make sure that everyone sort of understood the topic and could make decisions for themselves accordingly. Not a lot of funding, if any funding, provided for this effort on the private water system side, but we were making use of available funding that we had to support this work so that we could inform residents. We also developed a fact sheet on how to read and interpret your water sample results, because we found that was a need. People would get these results of their sample and then struggle to understand it. So we also provided a fact sheet on how to read your water sample result. And then you see number 2, we had another round of testing where we tested 77 wells in about 4 areas. And we'll talk a little about that in our next slide, if we could advance. Next slide. There we go. So as we move forward in time, after that work, later in 2021 and in 2022, we'd applied for 2 different US EPA multi-purpose grants for sampling of private water systems in areas of contamination, known contamination or suspected, and both grants totaled about $64,000. We had a few delays, as you can imagine, moving out of and through COVID. We had some delays along with some other challenges. And so we ended up getting to sample that work or those areas, those 4 areas identified where we knew we had some contamination occurring in the fall of 23. At the time, we used a contractor to collect and analyze samples in both sampling situations and in advance, where ODH and local health district staff went out and knocked on doors to garner participation. Next slide. So just a few lessons learned from those sampling events. In the area of the larger area where more wells were sampled, 126 wells were sampled. It was in an area where there was some known the PFAS subject had been talked about a lot. It was in the media, local media. There was some awareness of it. Plus, that area income was a little higher, education levels were a little higher, and so people kind of knew the topic and were participative. They participated in the program largely. We didn't have any problem identifying and sampling the areas we needed to sample. But when we did the work in 23, we realized we really struggled. Our grants, we were targeting 80 samples, and as you saw, we got 77 private water systems owners to participate. So it just didn't really seem to elevate to the level of what the lay public was dealing with on a daily basis. Didn't seem to resonate with them. Part of the problem was we didn't have a lot of funding to support detections. We just provided them information about treatment and things that they could do to mitigate when sampling was, or when results were identified or detections were identified. And we also learned that we needed to expand expertise and capacity. Next slide. So about that time EPA was communicating that they were changing their thresholds, lowering them. And at the same time, and as a result, Ohio EPA was planning for these changes in what we were terming then as PFAS 2.0. So it was really an effort to revisit and update the PFAS strategy. It was going to be more comprehensive, to include assessment of Ohio's rivers, the macroinvertebrates and fish, development of PFAS consumption advisories, statewide AAAS take-back program, investing in source investigation and control, and to really include additional follow-up sampling for public water systems and a more comprehensive sampling program for private water systems. In the development of this revised plan or updated plan, we really wanted to get some experts to help inform and support our decisions and the things that we were talking about. And about that time, we became aware of, we being the state, Ohio learned of the NGA and AAAS requests for applications for this effort. So it was really timely that this came about. And so we took advantage of that collectively, both the Department of Health and Ohio, the EPA. We worked on a proposal together and submitted that. Of course, applications were due March 5th. And then at the 1st of April, we were selected and we're having our initial planning call to organize our PFAS retreat. And that retreat was set to be scheduled in May of 24. Next slide. So the dates selected were May 20 and 21 of last year. The PFAS retreat was hosted by Governor DeWine's office, the AAAS Center for Scientific Evidence in Public Issues, the National Governors Association, and Resolve. Attendees included federal agencies, USGS, US EPA. We had our state agency partners involved, the Department of Agriculture, Ohio EPA, of course, ODH, and we had participants participating remotely and in person from our state counterparts in North Carolina, New Jersey, Michigan, and also, of course, Ohio. We had private consultants attend and talk about some of the sampling work that they had done in some of the areas of the state. There has been some private testing contracted through consultants. And so we had one of those consultants in speak to their efforts and what they did and what their experiences were with sampling. And we had academic experts in the room. Topics discussed and focused on included prioritization, sampling and testing, mitigation, communication, and outreach. Next slide. We'll break those down in a little bit more detail. So for prioritization, there was lots of discussion about these topics, as you can well imagine. Lots of time invested in trying to really understand and come to some solutions or thoughts about how best to tackle the subjects. So for prioritization, it was, are we going to evaluate and focus on mainly areas of known contamination, or are we going to evaluate the entire state? What other additional information might be considered in that approach, whether it is targeted or whether it's just more broad in general, to include demographics, the number of systems in a given area, etc. Additionally, how was sampling going to occur? Was ODH and the local health departments going to do it? LHD, local health departments, were we going to use contractors to do sampling? Was it going to be on a first come, first served basis of the residents? They would just reach out to us and we would, respond to each request as it comes in. Was it going to be scheduled sections or areas of the state? How would sampling requests be received and managed? That was a big question. Are we going to have a person sit next to a phone and take these calls as they come in? Or is there going to be some other mechanism to receive requests, like an online registration sort of option? And then we're kind of moving in now to some of the content that Rebecca Eicher was mentioning in the outset of the discussion. So we had a presentation by USGS of the self-collection and mail-in test kits in their research project. And we also we talked about that option and also talked about the state collecting samples. And in that process, that was another area of debate and discussion around what would be the best approach. How would we get the biggest bang for our dollar, even though those dollars might be limited? So lots of discussion there, discussion and debate around, we know for PFAS, samples can be contaminated somewhat easily. And so that was all discussed, whether, particularly in the context of self-collection versus state collected or a contractor collected sample. And then we also talked about the fact that testing PFAS is one thing, and getting participation, as we talked about, our experience was that participation was low. And in some of our discussions with state partners, they talked about maybe you broaden the topic. Maybe you don't talk about testing for a particular contaminant, but you talk about testing as a safe drinking water program, something to that effect that's a little bit more broader, that maybe connects with them better or resonates with them more. And so we talked about other things that we could potentially include in such an expanded program. It would be PFAS specific, but we know we have areas of naturally occurring arsenic in drinking water. We know we have areas in the state where there's naturally occurring elevated manganese and nitrates and so on from agricultural activities, et cetera, as well as coliform. So those are discussions that occurred. Mitigation options, lots of discussion around mitigation options, point of use, point of entry, and associated costs. We talked about connections to public water systems and or the modification of existing wells, of course, drilling deeper or replacement wells. All of those options come with sets of pros and cons, and varying levels of cost and varying levels of homeowner participation. And so all of those were discussed in depth and weighed accordingly. And then we talked about outreach and education. It should be prioritized with any amount of funding and any effort that's being considered, because you really have to market and educate and inform the public in advance of the effort so that you get participation and uptake into the program. Next slide. So just to build this out a little further on the mitigation side, we kind of touched on this already. There is no one size fits all solution. Both treatment effectiveness and cost have to be considered. Maybe we look at this from a long-term or short-term and a long-term approach, where we have some short-term options based on positive detections, short-term options to get us through a period of time to get us to what that longer-term solution might be. And so we also talked about different funding options for mitigation and treatment. And some states talked about the programs that they have that generate funds to help support such activities. We also talked about other things like potentially reimbursement programs for homeowners. In Ohio, there is a tax credit program for a homeowner who controls lead hazards in a pre-1978 home. For example, they get a tax credit if they expend funds to mitigate those hazards. And so in this case, we talked about, could there be an option or a similar program for private water systems owners? And then we talked about the point of use, the carbon filters and reverse osmosis, and their relatively low cost, starting around $100, maybe a little bit less. But then, the replacement media costs over time is where it can be really a limiting factor for some families, and that gets you in the range of $200 or more, depending. Next slide. So, at the conclusion of our PFAS summit, we were working through all this so that we could build on our 2.0 strategy, but also in the context of how are we going to fund such work. And we were at the time approaching a budget cycle, and our budget submissions and proposals are all due roughly in the summer to early fall timeframe last year. And so we developed a proposal for consideration that would be $5 million a year for 2 years, or a total of $10 million over the biennium, that we would sample the state in areas of known or suspected contamination as a way to begin to prioritize and build out this program, that we would include the 6 PFAS compounds along with lead, arsenic, manganese, nitrates, and E. coli. We proposed that we would develop an online registration tool using open source software like RedCap or potentially SurveyMonkey that the state uses here for such activities. That there was concern and discussion around how would we deal with someone who wanted their well sampled that may not be in these priority areas. And so this is where we considered the in-home kits, that we would buy a few of those, have a cache of those purchased and ready to go and available. If anyone expressed concern or interest in having a well tested that was not in a priority area and did not want to wait, that we would have this as an option. We could send them a kit, they could mail it in, get the results. And then if there were detections, we would follow up and do the sampling in their area or at their residence to confirm any detections that might come back from the in-home testing. And then during the retreat, also, we became aware that we could use BIL funding to support some of this testing. And that's the bipartisan infrastructure law. Some of that funding through our state revolving loan fund could be dedicated to private water systems work. And so we decided we would put together a similar program and pilot that to learn from some of these additional things that we're adding to the program, and then maybe scale that if funding became available through the budget. And we would, of course, dedicate money for marketing. And then in addition to that, we have also become aware there's some settlement dollars that are pending, and that some of those funds could be used for this work. There is a dedicated 6 to 7 county area where those monies would be utilized, but that's where we would target those efforts. And so as we progress in time to today, the budget proposal was not accepted. And so we're considering using this BIL funding and planning to use this BIL funding and settlement dollars in the state for a sort of scaled down project. Next slide.
And Jean, just we're getting close to the end. I think you just have one slide left or so. So
Yeah, I think I just have one left, I believe. So anyway, in short, because I know we're getting close. So that's what we're doing, is working on our funding on a program that will be funded through the bipartisan infrastructure law funding. Ohio EPA and ODH signed our MOU earlier this month. We are working through our selection of areas, and we're trying to identify those areas because they have to be in areas of close proximity to public water lines so that they can be extended. The funding is limited to areas where it's just for sampling and identification of PFAS contamination in areas where public water lines can be extended. So that's what we're working on currently. And we are working to hire personnel, update our materials, get a contractor in place, and our marketing campaign. So I'll stop there to provide opportunity for questions.
great. Thanks so much, Jean, for sharing that information. Really painted the picture of kind of the challenge that you're trying to tackle in the state and some of the discussions and solutions the state is finding and path forward. So we did have a few questions in the chat that came in during the presentation. Thanks to your colleague Zuzana, who responded to some of them. And maybe just picking up on one of the questions or one of your last comments and a theme from the retreat around prioritization. There are, as you mentioned, there are kind of, limited funding resources to implement this program. And you mentioned the budget request, but moving forward with the BIL funding at the moment. And just wondering, kind of as you're thinking about how to move forward with the testing and mitigation program in the state, how do you approach kind of the need to prioritize the resources that are available and how they're used? And is there any particular information that has been guiding your kind of decisions about where to start the testing program? Oh, and you're on mute. Sorry.
Apologies. Again, we're still finalizing those details, but we have a selection of about 40 sites to start with in areas of known contamination. We'll be working with our partners at EPA to sort of get a sense of those, where could water lines be extended, because that's a key factor in our testing approach. So that will really begin to narrow down how we prioritize and spend the dollars, if I'm answering your question.
Great. That sounds good. Thank you.
Mm-hmm.
We had another question kind of on the technical side of the, and actually I think your colleague just answered it, but I'll go ahead and ask. And I'll encourage others who are participating in the webinar, if you have a question, feel free to raise your hand and ask a question. But we've got a question from Todd Kaiser about how the sampling and how that sampling worked, and how you accounted for sampling when existing water treatment systems were in place, and how did you did you implement any pre or post filter samples? Was the priority for the source water or the served water for analysis?
Yeah, so we did not, when we do our sampling, we always try to sample ahead of any treatment that they have. That's part of our conversation and communication to homeowners. We try not to sample ahead of, or we try to sample ahead of treatment. So we're getting raw water, so we know what's in the aquifer. And then we really don't sample post filtration. We haven't to date anyway, and so that just hasn't been, part of most of the treatment that's on is saltwater softeners to address hardness and some other aesthetic, aspects of the water. But we try to start with and understand what's in the water as the source water, not the treated
Mhm.
or finished.
Thanks. There's another question about the registration link and whether if there's a link available, if that's something that you can share. But if
Yeah.
not, I know that there was quite a bit of discussion at the retreat about kind of how to get in touch with homeowners or private well owners, and you referenced kind of the education and outreach component of the program. So I think if there's anything else that you wanted to share about that.
Yeah, it's not available yet. It was talked about, it's planned for. We plan to do it. It's not yet. That last slide I kind of skimmed through very quickly. Those are our efforts that we're working on currently. We just, like I said, finalized our agreement with Ohio EPA for the funding, and we're trying to get people hired on to begin to help support this work. And so those aspects of the program are not completed yet, but we're certainly happy to share once they are. And to the point of homeowner outreach and education, absolutely, that would be included. So if you're interested in participating, go to this link, fill out the information. But it's really going to just be name, contact information, which will include email address, so that we can communicate electronically as well as through U.S. mail, and maybe some basic information about their private water system, just so we have a sense of what's on the facility, at the residence when we go to sample. It would probably include questions about: do they have a softener? Do they have an ability to let us in the home to collect or provide us access ahead of any treatment?
Great. Thanks. Wanted to ask another question. You talked about using the home test kits, the mail-in test kits for water. And my understanding from being at the retreat is that that's kind of a new direction for the state. And so I was wondering if you could share a little bit more about, what informed the state's decision to incorporate kind of a PFAS home testing kit into your private well testing plan.
Yeah, if you recall, during the retreat, we had lots of voices in the room, and there was some concern that if we conducted sampling in a prioritized way and didn't accommodate someone outside of that priority area that may have a real interest in getting their water sampled, that might create some contention, whether in the legislature or in some other political way. And so we wanted to be able to address that need in a way that wouldn't sort of derail our planned priority approach. And so we thought we would utilize the in-home personal test kit that we could mail and send to those individuals. They could sample, and then when detections come back, or if they did, then we could go out and resample. And it was also a way to manage resources that are limited. Because, and and that was in the larger scope of the program. In the context we're operating under now with BIL funding, that's if it's not a priority area, or if it's not in an area where water lines can be extended, then they're not going to be eligible for sampling. It's just a limitation of the funding.
Yeah, great. I think that's helpful to share a little bit more about why you're thinking about that. And if I recall from I might not be using the right terminology here, but from the USGS presentation on the information that Rebecca Eicher presented earlier around kind of their process for testing public and private water systems, when they used the private water or the mail-in kits for the private water system, they incorporated blanks into their testing program to identify any potential contamination, and really found didn't find any. Maybe they had one sample returned with that was contaminated, but for the most part, they found they were.
Yeah, not to diminish that effort or that approach. I just think for Ohio, it's not the primary approach.
Yeah, great. Thanks. Well, we are just about at the top of the hour. And so as we're wrapping up here, I want to invite my colleague from the EPI Center to put the link, that's a link into the chat. Again, kind of for participants, your feedback on the webinar today will help us shape these and improve them looking forward. So please click on that link in the chat and fill out the survey there to provide some feedback on the event. Jean, I saw a request for your contact information in the chat. And so if you're comfortable sharing that, looks like a few people might have some follow-up questions. And I just really want to thank you, Jean, and your colleagues for organizing the presentation today and sharing this information, and Rebecca Eicher as well. Appreciate all of the participants who have joined us to listen in and ask questions. Hopefully this was helpful in terms of sharing some scientific expertise that informed the planning and decision making in Ohio around kind of a voluntary testing and mitigation program for private wells. Jean, any kind of, as we're wrapping up, any last thoughts from you? And then I'll turn to Chris Fletcher to close things out.
No, I don't think so. I'm adding, I'll be putting in my contact information, and Susanna Bohr, who was answering some of the questions there. She's sort of taken over the private water sewage program, and so she can also help answer questions. But what I did want to add is I did want to extend Ohio's thanks to Resolve and NGA and to AAAS for this effort and opportunity. It was appreciated. It really helped us build out our program. And so we just wanted to extend our thanks. Thank you very much.
Thank you. And Chris, any closing thoughts?
Just echo the thanks to Jean and the Ohio team. Really appreciate you sharing your work with us, and excited to be a partner with you and support you all going forward.
Great. Rebecca?
Just wanted to show my face to smile and say thanks. It was great to have this conversation and to see the chat. And if you have any questions, feel free to reach out. I did put my contact email in the chat as well.
Great. Thanks so much, everyone. Really appreciate your time today. Hope you have a good rest of your day, and please reach out with any questions. Thanks.